Hi, everyone. It's June, Men's Health Month, and I thought I would talk about another issue that affects a lot of men, which is erectile dysfunction. So, erectile dysfunction is a multifactorial disorder, meaning there's many different types of things that can cause it. And when I think about underlying issues, I put them in about three categories. So, underlying issues would be hormonal imbalances, interruption in appropriate blood flow, or neurological. So, and then of course, then there are more psychological and kind of psychosocial issues. Let's say you're not really feeling good with your partner. That just psychologically is going to affect your ability to obtain and maintain an erection. If you have some undiagnosed issues of trauma at an earlier point in your life, sexual trauma, that could play a role, of course. But on a physical level, I usually think about these three categories. So let's break them down. Hormonal imbalance. So oftentimes, if we can improve a testosterone deficiency, that will help erectile function. So if the blood panel is done and a testosterone level is at the low end of the normal range, or certainly below the normal range, augmenting that can very much help. Now, also, it's important to look at how testosterone is being metabolized. So if the testosterone is in the normal range, but at the low end, but estradiol level, which men have too, is high, that can actually reduce the ability of the man's body to feel testosterone. Higher levels of estrogen actually create more sex hormone binding globulin by the liver, which binds up the free testosterone, reducing the free fraction of testosterone that can exacerbate erectile dysfunction. So from a hormonal imbalance perspective, what can you do? One is you can work with some of the testosterone precursors like DHEA and pregnenolone. Or two, if you've done that, that's not working, you can see a doctor skilled in bioidentical hormone balancing for men and actually work with some bioidentical testosterone. If you see high estrogen, you can work with one of my favorite supplements that I've worked with for years and years, chrysin. Chrysin is from the white pulp of grapefruits, and it reduces aromatization of testosterone from testosterone to estradiol. That can be incredibly helpful. You can also work with calcium D-glucarate, which is a form of glucuronic acid derived from cruciferous vegetables that enhances the liver's elimination of estrogen, so that it improves the ratio of testosterone to estrogen and ultimately can reduce the production of sex hormone binding globulin and raise free testosterone. It's a lot of information, but just know that there are some supplements that can help you. And of course, there are pharmaceutical aromatase inhibitors that can be prescribed by a doctor that does bioidentical hormone balancing. So then blood flow. Sometimes there's vascular disease. So it's akin to cardiovascular disease, where you have plaque on the inside of the arteries feeding the heart muscle. It's that you have plaque on the inside of the arteries, that are supplying blood to the penis. So looking at risk factors for vascular disease, like high cholesterol, untreated high blood pressure, and of course, looking even at the whole picture of family history and diet, propensity to diabetes. These things can put you at greater risk for this vascular disease that can affect erectile function. Now, the good news is it's reversible. So if you change your diet and lifestyle and take other measures to reduce cholesterol, if you improve your blood pressure and reduce your tendency toward diabetes, or your kind of the place you are at in that journey toward diabetes by changing your diet, exercising more, you can improve erectile function. And I've seen it hundreds of times with men. When you change the lifestyle, that improves. And then finally, the neurological aspect of erectile function. So back to a topic I've discussed earlier, prostatitis. The nerves that innervate the penis and dictate the erection actually travel kind of right next to the prostate. And if the prostate is inflamed, those nerves can get inflamed also. So a very common cause of erectile dysfunction, is an undiagnosed prostatitis, like an infection in the prostate. So I urge you to get a blood draw, to take a look at your PSA and even a urine analysis and culture to see if there's any bacteria you can capture in the urine. So you can think about inflamed nerves, or even an autonomic neuropathy that can be caused by other types of infections in the body at large. So take heart, because if you have erectile dysfunction, there's things that you can do, but oftentimes, just like anything else in medicine, it requires a deep dive to kind of get to the root of what's going on, correct that root, and then take care of it. And if it oftentimes will get better. Now, there's some really interesting treatments on the, that are available now for men. There's like a deep ultrasound treatment that has done wonders for men and their erectile function. And it's kind of almost like shockwave, but done in the penis to improve the blood supply and the blood flow and break up adhesions that might be interfering there. So that's something for you to look into or discuss with your urologist. But anyway, I hope that helps, because there's so much that can be done.